I will start. So it is like
Wait. Soumya.
so. Just
Okay.
scenario. It's
Mother's name is Jessica.
mhm, cleft lip and cleft palate. And how old is child?
Just born one day.
Okay. All right.
He
So
was taken to an egg.
okay, I will start. Hello. Good morning.
Good morning.
I am Dr. Hiren, one of the doctor here. I believe I am talking to Jessica.
Yes, doctor. I am.
Okay, thanks for coming, Jessica. Nice to meet you. First of all,
Yes,
congratulations
same.
to you for a new baby.
Yeah, thank you, doctor. Thank you. But
So,
I did not see my baby.
yes, Ms. Jessica, I am here to talk to you about your baby's condition. So, Ms. Jessica, did any one of our staff or the doctor talk with you regarding your baby's condition?
No, doctor. Immediately after delivery, they said baby needs to be observed in an ICU. So they take away from me. So I am a little bit anxious. Is there anything serious, doctor, with my baby?
No, it is not much of the serious. But before I start the talk, Jessica, would you like anyone else to attend with you?
No, doctor. My husband has just gone down. So you can talk to me. If anything serious, I'll call him, or you can start now otherwise.
Yeah, it's not a serious matter, but there is something which I need to discuss with you. If is that the right time, I can start the talking.
Yes, doctor. You are making me anxious, doctor. Please tell me what happened with my baby.
Yes, Miss Jessica. So first of all, your baby is absolutely doing well. Um and is nice and all the other things are good, only there is one little concern is uh, regarding development of the lip and the upper part of the palate. You know this the structure.
Yes, doctor. I know lip and palate. What happened actually, doctor? They, I didn't see it actually.
Yes, Jessica, what happened is there is some, the cleft in the lip and the palate. There is kind of uh, there is a gap between the upper part of the lip as well as the in the center part of the palate.
Oh my God, doctor. I have seen such babies, doctor. They look so bad. And what will happen, doctor? Like my why, doctor? Why this happened, doctor? Please tell me why this happened.
Yes, I can understand that, Jessica, you look quite worried about, and I can appreciate your concern and worry. Jessica, uh, first of all, yes, it is difficult for you uh, to to have in this situation, but I will try to explain you. First of all, this condition is not a serious concern, and there is a treatment, there is a solution for this. Initially you feel like these babies look they have a kind of a bad shape, you feel like that, and they don't look good. That's that you will have this kind of feeling. But later on, generally this cleft lip usually it can be repaired at the age of 3 to 6 months, and this problem cleft palate also can be repaired at the age of 1 year. And after that, they have when they grow up gradually, the shape will come back to as of like the normal child.
But doctor, is
Yes,
it my fault that this happened, doctor?
yes,
What are the reasons?
I appreciate your question. It's a valid question. I'm coming to that point. There are several causes. Sometimes it can happen because of if someone in the family they have the same condition. Sometimes if if you are taking some medicine for the fits also it can happen, and sometimes it's because of the some association with the faulty gene also it may happen. So it is not your fault at all, but it's a matter of chance. So it happened with you. Are you with
So,
me?
doctor,
Yeah.
yes, doctor, I'm with you. So, what will you do now for my baby?
Yes, Ms. Jessica. For the time being, there are some challenges like for the feeding. The baby who has this condition, they have some difficulty in the feeding, but there is a solution for that. There is a special kind of nipples available. With the help of that, also we can manage a nice feeding, and we'll do follow up regularly, and we'll also do regular observation about the growth in weight. And once the baby reach to the age of 3 months, we can consider, I will make an appointment with the surgeon and the team who deals with this condition, and
Explain it.
the specialist in this surgery will also explain to you and will talk to you about how to repair and what are the procedure for this. But this comes after the age of 3 months.
But
So
doctor, if you're saying that we are using special nipple for feeding, then why are you taking to an ICU? Why don't you keep with me, my baby?
yes, Miss Jessica, we'll give the feeding first of all. We'll take the baby to the neonatal ICU. There we will do the full examination, and we'll uh, start the milk with the special uh, nipples and the special feeders, and also we'll arrange a meeting to train you how to feed with the help of that nipple. You can give your
Mhm.
express milk and can give this breastfeeding itself with the help of the feeder.
Mhm. Okay, doctor, but why don't you just do the operation right now so that we can take the baby, good baby at home? What we'll say to our relatives. Just do it right now. No harm in. I'm ready to sign the consent form.
Yeah, I understand, Jessica, that you are very keen to have all the normal baby and you want to take the baby normal at home right now. But because of the matter of the development, there are some parts still it needs to develop. Then only it can be fixed at the after the doing surgery. If we do surgery early, there can be the long-term problem with the uh, correction of the leaves as well as the palate. So it is very essential to allow that part to grow, and then it is better to do the surgery at the time of when there is a proper development of the lip as well as
Mm-hmm.
that part.
So, doctor, then once the surgery is done, my baby is okay for lifetime?
Yeah, this is a very good question. Once generally the surgery done, after that they usually do good, and they have a very good outcome and kind of a normal life. Yes.
Okay, okay, doctor. Thank you for giving me the information, doctor.
Welcome, Ms. Jessica. So, if you don't have any further question, I would like to go through the point which we discussed. Is that okay with you?
Yes, yes, doctor.
So, Jessica, we discussed today about this condition, the cleft lip and the cleft palate, the reasons why it happens, as well as when and how it gets fixed by whom. And we also discuss about the possible outcome after the procedure. Meanwhile, I would like to give you some of the leaflet uh, so you can go through it. And still, if you have a further question, I'm happy to arrange a next meeting. We can discuss during the next meeting. And at any point of time you have any concern, please do not hesitate to contact. I will give you the contact number also along with the leaflet.
Thank
Thank
you,
you.
doctor. Thank you.
Thanks for your time, Jessica. I wish a good and speedy recovery to your baby.
Thank you.
You are
Just
welcome.
15 seconds more than the routine time.
Yeah.
Almost 9.5 minutes.
Okay.
So it was good. Sympathy, empathy, agenda. I think you had forgotten to ask attendant, but you asked later, or you maybe
I
you
asked, yeah, but
plan to
I
ask.
came to a little bit late.
Yeah, I thought you forgot, but you might have planned to ask later. That is fine, no problem. Uh, this actually there was one at one place you did not listen to the question and you answered something else. Like I asked, why doctor, why it has happened? There you counseled me and said it will be repaired and there will be no problem. You did not explain the reasons. There you did not listen to question properly. Okay.
What was the question?
I said like doctor, why it has happened? I'm very much scared. What will I tell relatives? And then you said like, don't worry, it will be repaired and it will be okay later on. But you did not answer why it did happen. But I again asked the next time the same question. Then you answered it properly.
Mhm. Okay.
So role player concern you have to hear properly. Then there was a question why the baby was taken to NICU.
Hmm.
Why not baby with me? You answered nicely, but actually we can say here we are fear that because of this cleft palate, some of the milk can go into the breathing system and it can cause some infection. So we are worried and want to give feed under observation.
Hmm.
Aspiration can be a complication initially. So till the time baby can take feed properly, we will keep the baby in ICU. You also answered nicely that we will train you properly, then only we'll give to you. That is also fine. But I think aspiration could be better here, along with the way you answered.
Hmm. Hmm.
Other question was like, why not now? Why later? Why wait for 3 months? So there also you did well. That the parts of the lips and palate needs to grow up properly, otherwise surgery will not be proper, it will not be aligned properly. It was nice answer. Last question, what was the last question?
Uh, you asked me about the outcome prognosis. He will be okay for the lifetime.
Yeah, what is the long term? Actually in the long term,
Hmm.
uh, yeah, we can say like most of the babies do well. However, they require some voice training, may require some voice training in future.
Hmm. 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 Yeah, nasal twang and all. Yeah.
Yeah, they might need some voice training, and we may refer you to the speech and language therapist later on for that. But right now, it is difficult to predict which baby will require that type of therapy.
But
But in general, regarding the life expectancy and development, they do as per their peers. There is no problem. But if the speech problem comes, then we might need to refer to speech and language therapist. That
hmm,
one thing.
that
We
happens
handle quite
in
why
a
because there.
right in
Yes.
palate, but in cleft lip, the things are generally fine.
Yeah, things are cleft lip. There is no problem. Even they don't take the baby to NIC also for feeding and all.
Yeah.
In cleft lip, if they only cleft lip is there, then we have to just counsel regarding the feeding nipples, and surgery at the age of I think 3 months. Surgery at the age of 3 months. Just give support and counsel the mother.
Right. Right.
What else we will say in cleft lip? Only cleft lip is there. Then what else we will say?
If it is only cleft lip, like
There is
yeah,
nothing much to explain actually.
even nasal twang or speech difficulty will
Hmm.
be less in the cleft lip, and feeding.
There is. There was one question like, will my next baby will have the same problem? Then what will you answer in there?
Yeah. The chances are there increase. Yes, chances increase.
Yes.
Just a
Yeah,
minute.
take your call. Take your call.
Yeah. Sorry for that. Okay.
Okay. So anything else?
Mm, Okay, Irfan. Okay, Irfan is here. You want to say in
Yes,
this?
boss.
You
I
want
just
any?
I just joined. I just last this conversation. I just
Okay.
heard, and I don't know what was the questions, and it's not good to give the poke the nose without knowing anything what happened.
Yeah, yeah. We
So
just discussed this cleft lip,
yeah,
not difficult task actually, but just
The
need
new scenario.
something new.
for cleft palate, we used to bring baby in the NICU.
For the training, yeah, for there is a special nipple. I forgot the name of that. That we need to train.
Special teeth.
Yes, yes. There is a name for that
Special
Yeah,
special.
there's
uh,
like I find
for
and
cleft palate, there is obturator plate is there.
Yes,
They that use obturator plate.
yes, yes.
okay, and why we cannot give training same with the postnatal ward or nursery? Why in the NICU?
Initially, depend on the severity of the cleft palate, baby may
Okay,
aspirate the milk. So initially, maybe nasogastric feeding will be tried initially.
nasogastric initially.
Initially,
So
if
yeah,
the cleft
so
palate is
now
like complete cleft palate.
what is the reason why bringing baby in a intensive care unit? It will be very
Yeah, maybe
hard,
it
difficult
may be in
for the
transitional
parents.
care also, not intensive care, maybe transitional care also, but it will be under observation. Sister will give the feeding and
Yeah, but it
nasogastric
can be
feeding.
in no, it can be in the postnatal ward or nursery. There are also staff, not in. It's not without
But
staff.
it
The
will not be
postnatal
with
ward.
mother initially, under
Sorry.
observation somewhere. Baby will
So I
not be
mean,
with mother. If the baby on NG feed, no, initial period, the baby will not be with mother.
but we usually encourage or what is called we promote the baby friendly system. You know.
Yeah, yeah, that's true, but we don't know UK system actually, what they,
Did you
the
go
other
through
meeting
NHS
discussed.
NHS for this
Uh-huh.
cleft palate?
Okay,
Did you go through? Did you go
okay.
through?
Yeah, yeah. I'll find out the leaflet and share on the group. We will check that. Yes, right.
No, no. I'm
That
asking
can be
you.
done.
No, no. I'm asking you. Did you go through for this?
No,
Yes,
no, no. I didn't go because like
Uh,
Hiren was preparing for that, so I did not
uh-huh.
go through that leaflet. I'll find
Yeah,
out and.
because usually, Dr. Sandeep, we try to
Mhm.
avoid any extra information which
Right,
and
right.
we are not
You are
confident.
absolutely right.
Try to avoid. This is helpful because if we are continuing giving information from our own observation or from our own setup, like India, Pakistan,
Right.
so and it is not practicing there, so it will be a wrong information. So they may get, the
Yes.
examiner will get angry why he is giving uh, the thing which is not being practiced here, why he's giving extra things, any extra admission, something like that, any in a which is not suitable. Like NICU is a very horrible place for any patient, for any parents. So when they heard why my baby is being taken in the NICU, it will be not an easy to tell them. And when they hear the baby is in the NICU, so they will think that he has big problem.
mhm.
So that
Yes.
this
Yes.
is my concern.
Yes.
So we
We
are
will check.
Okay. Okay.
That is very good point actually. We will check. I'll try to find out the leaflet and update in the group.
Yeah.
Okay. So the next, Dr. Sandeep, which one you will do? Drug,
I will do unlicensed medication.
unlicensed. Okay. How much time do we need to reconnect, or
I don't know time. You have the
is it
setting, no?
clearing
I
any
think
of these things?
I think we will reconnect.
We'll reconnect, no? Okay.
Yeah.
Stop.